Hi, and welcome to Immunity Blueprints. Today with us talking about another view on immunity and the immune system is Melody Keller. And Melody Keller is a licensed naturopathic doctor. You are currently transitioning now to seeing your patients online.
Yes.
And you have 3 kids with 1 on the way.
Yes. Yep.
So you are busy. So just a little. We appreciate you taking your time to come and share with us your wealth of knowledge about the immune system and how we can help ourselves boost and support our immune system.
Yeah, I'm happy to be here.
Great. So can you start just by explaining what a naturopath is and what it is you do?
Sure. A naturopathic doctor is the equivalent educational level of a medical doctor. We just have different different philosophies and different views on things, but the same level of in-depth training. So I've had all of the ologies and things that they all have, and all those diagnostic skills, lab tests, blood work, all of that sort of thing. But where we differ is the philosophy. I'm looking at the whole body and what's blocking, what's the obstacles to the cure, and trying to help the body heal while doing little to no damage as much as possible. There's a whole healing order and things. So we, in addition to all of your typical medical fields, we're learning herbs and homeopathy and nutrition and hydrotherapies and light therapies to some degree, kind of blended in there with that hydrotherapy training. So lots and lots of different tools in our tool bag beyond the typical drugs and surgery. But it is a 4 to 6 year program, just depending on how long.
And how did you become interested in this field?
I was raised with a lot of natural stuff. I grew up taking vitamins and some acidophilus for stomach issues. My parents used Shaklee cleaners as a kid, so it was always just kind of a piece. But I remember being interested in just the human body from being young. We had the set of encyclopedias, and I'd look at the human body section, had all the clear overlays to look at all the different systems separately, and trying to learn about all of that just from what I could gather from the encyclopedia. And as I got a little older, I started volunteering at a hospital. I loved working in the nursery with the babies. They let me help out there. So that was really fun. But then as a teenager, I discovered herbs. I started listening to some tapes of some old herbalists and learning that, wow, there's even cures for really bad diseases that there's no medications for. You can treat those with natural substances and diet. And, I don't necessarily agree with everything I read from back then. And heck, I can't even listen to the tapes anymore. I don't have a tape player, but, and then a friend of mine as a teenager, her aunt worked at an herb store. So we used to go buy our own bulk herbs and have an encapsulating device. I could make my own capsules of things and take those. So it was really interesting, just kind of more, I started learning herbs more from an Ayurvedic perspective because that's the way the book was, but that's not really where I go with things now, although I do really appreciate that philosophy there is helpful. So that was interesting. And then just being interested in medicine, I didn't know how that was going to work with, how do you do that? And then I discovered that you could actually get a degree in natural medicine as a doctor. And that just really fueled my interest. I grew up in the Seattle area, and Bastyr University is there. And once I discovered that, I started really exploring their program and designing my high school and early college to get into that program. And I'm really glad I did. Lots of work, but very much worth it. I had some really excellent teachers.
We're glad you did too. And so as a naturopath, then how do you help your patients to, with your patients all have compromised immune systems clearly. So
Right.
kind of what's the process you go through? And I assume, because you were just talking a lot about herbs, that you incorporate some herbal remedies as well?
Yes, I do. I do work with herbs, supplements, that combine, herbs and vitamins and a number of things like that. But before we get that far along, I want to know what's going on with them. I get a really thorough history, when appropriate in office, we'll do an exam. But, sometimes you just look at the person and go, their color is just not quite right. Or, their eyes just don't have any sparkle, that kind of thing. So you can really gather a lot just from looking at somebody. But getting the history and then discovering, doing some lab work, looking at blood work from a functional analysis. I have so many patients that come to me like, I feel sick, I feel tired, I never have any energy, and my doctor says it's all in my head, my labs are normal, and normal is, a lot of made up of a lot of sick Americans because it's chronic, so it's common. So I actually use a much more functional range that's more narrow. I'm looking for optimal. And when things aren't fitting in the optimal picture, there's different combinations of how things display before, preclinical signs and things like, well, certain markers are high, you might have this, or certain markers are low, and these ones are high, you might have other things. So it's really interesting, and I can create reports for people. I'll look at organic acids to see how the different metabolic functions are working in the body, and food sensitivity testing is also really helpful. We can test for toxins, heavy metals. It kind of depends on the person, and for people with some immune conditions or something that's making me lean towards Lyme and its associated conditions, rheumatoid arthritis is potentially a Lyme infection or some other bugs, and we'll probably come back to that a little later. But there's panels you can test for those, and those are kind of tricky to test for because they don't always stay in the blood or the serum. So it's more of a clinical diagnosis, and there's some questionnaires that can point to it, and treatment can go from there. But there are some labs that can be really helpful there, both looking at the functional outcome of what the body is doing, as well as what might be hiding in the system.
Let's start basic before we kind of jump into deeper, more technical information. I just wanted to talk just really briefly. You mentioned food sensitivities, and most people don't understand food sensitivities, especially as it compares to food allergies.
Right.
But they also don't understand how a food sensitivity can really affect their immune system and their overall health. Can you talk a little bit on that?
Sure. So a food allergy, that would be, like your typical peanut allergy. If you eat a peanut, you're likely to die. Your tongue will swell, you get hives, you can't breathe, any number of those sorts of things. This is totally different. That is a part of the immune system, and the immune system has 5 different immunoglobulins. So typical allergies like that are an IgE type mediated allergy. The food sensitivities are generally an IgG or an IgA, and those have different roles in the body. The IgA is the immunoglobulin that lines your mucous membranes, your nose, your mouth, and actually your entire gut system is lined by that too, because it's technically outside world. It's the only part of your body that's coming into contact with things from the outside. It has to get through lots of membranes in order to get to the inner spaces. So that's protected by that. And the IgG is more of a general immune thing, but that takes reactions for that can take, a few hours to a few days to show up, and it can settle anywhere in the body. It can cause chronic sinus issues is a big one. In kids, chronic ear infections and swollen tonsils are a big indicator of some food sensitivities, dairy being one of the big ones there, but by no means the only one. Skin rashes, eczema, psoriasis responds really well to food sensitivities. A number of different gut issues, of course, respond to that because that's what your gut does. You're breaking down and digesting food, and if the foods are irritating your body, it's going to show up there. But migraine, headaches, joint pain, you name it. It depends on where your genetics tend to be a little bit weaker, where your symptoms are likely to show up. So what I'll do for patients, I've done some, we do elimination diets where we'll eliminate, the top 7 for, 4 weeks or something, and then test them back in. But there's so many different things you can be reactive to, and eliminating 90 to 184 different foods is not really possible for any of us, because we actually live real lives, and I'm not going to test one spice a day for weeks. So I do a blood test for patients, and the 2 that I have access to that I've really been liking can test either 96 or 184 different foods, depending on how much the person's eating, for pretty reasonable cost as far as that goes. And then we can see, if are they mildly or majorly. It goes from like a 1+ to a 3+ reaction, because they're testing it using, immune globulins and ELISA processing, which, getting into the lab side is not really my area, but I'll get the report back and I'll come back allergic to dairy and in all of its forms, yogurt and cheese, and which cheeses, wheat, gluten, beans, coffee. It's always a bummer when somebody comes back allergic to chocolate. Fortunately, it's not a common one. So that's a good thing, because
That's a good thing.
Yeah.
So how long, so when people get off, I've got a couple questions here. When people need to eliminate these diets, how long optimally do they keep them out of their regimen and then introduce them back in? And then also, can you tell us the differentiate between detoxing and draining?
Yes. Yeah. So as far as the food sensitivities go, with my patients, I usually recommend that they remove everything that is highlighted in red for at least 2 months. And this really gives the body time to calm down, because every time you eat it, you're making more immune globulins toward that food. And it can take a long time for your body to clear those if you don't need them anymore, from weeks to months. And some persist longer than that. So I'll have them do that. Once their symptoms have calmed down and things are improving and we know, hey, that really has helped your overall health, then I'll tell, let's start with the foods that were the mildest reactions, the ones, and pick the one that you miss the most. Some people, it's yeast, and well, they can't have wheat and they can't have yeast, but it's hard to eat gluten-free bread even if you can't have baker's yeast. So, and we want to try the purest form of things. So when we get to something like testing out wheat, a straight pasta is going to be better than bread, because it's just, wheat and water kind of a thing. So you're going to try that for, depending on if you get symptoms or not, for 1 to 3 days, and then wait to see if there's some delayed reactions. So I'll have people keep a food diary, like, hey, I've been doing really good, and then I decided, I'm going to test wheat. So I had pasta for lunch, and then my migraines came back and my blood pressure soared, and we're like, hey, so that's not going to stay in your diet. We're going to keep that out for longer. Wait until things settle back down, and then we'll try a different food. So the process can take a while depending on how that's looking. The other thing that's really helpful is if you're looking at a page of food reactions and there's, 10, 20, 30 different foods that somebody's sensitive to, it's telling me a lot more about the state of their overall immune health and gut health than just, wow, you're allergic to everything that you eat on a regular basis. Why? Why is your body reacting to these things that should be nourishing?
Right.
Well, there's gut damage. There's what a lot of people refer to as leaky gut. The cells aren't sticking together like they should. And so there develops holes, but also you're not absorbing the nutrients like you should be. The inside of your gut, when you get to the small intestine, they have villi, which are little fingers. So you've got shag carpeting, for example. Right. But the longer you eat those things, the immune system starts to attack your own intestinal lining. And before long, you go from shag carpeting to Berber carpeting, and you're not absorbing your food and nutrients, and holes start to develop. And that can also be due to infectious causes. H. pylori is one that causes, some ulcers, and that causes problems there. But parasites and worms, as disgusting as that sounds, also do cause that. And they eat the foods that we're eating, and their waste products activate our immune system as well. So maybe it's possible that it's not even the food itself. It's the byproducts from digestive waste from critters that are living in your gut and elsewhere that may be doing that as well, which is helpful. Because I don't want to take people off of their favorite foods forever. I mean, if you want your blueberry banana smoothie for breakfast with spinach in it, I don't want to tell you can't ever have that again. Your body's just off the charts inflamed. But we have to figure out why and get to the bottom of why is that happening, get rid of the bugs, help the gut lining heal. And a lot of times you can start to reintroduce a majority of the things that were previously causing you problems. Sometimes it takes a while. Sometimes it's a shorter period of time. It just depends on the person. But that definitely makes a difference.
So then what is the difference between detoxing and draining?
Right. So detox is a very specific process. Your liver does that with everything that you eat. So once things are absorbed and they get into the bloodstream, the liver is the first place that gets access to all the food and nutrients. It's filtering, it does all of these processes, it methylates things, which is part of the whole epigenetics picture as well. It's attaching little molecules to things so that they become more water soluble. They pass out through the bile and get flushed out through the colon. Detox is really important. There's 3 different phases to that, and each takes different nutrients and things like that. The problem is detox is just one piece. Drainage is a lot more general. So that's your body being able to eliminate. So you're having regular bowel movements. And I mean, like healthy, you want to have a nice long movement, 2 or maybe even 3 times a day. And it might not be, a foot long every time, but you want things to be moving out, because if that gets blocked up, it's keeping your liver from detoxing, because all of those chemicals that have been made less toxic and are supposed to pass out get blocked, and then they have to get recycled back and forth through the liver, which takes a lot of energy and a lot of time and a lot of nutrients to continually do that. So that's where you're going to get a lot of reactions. If you're just doing a quick 3-week detox and you're not having a bowel movement at least twice a day, you're likely to get, skin rashes and headaches and sinus problems. I mean, if you've ever tried a detox, just, off the shelf, like, hey, I think I'm going to detox, you might not feel real good when you start that. Yeah. But if your drainage is working properly first, there's a whole, like the funnel, the colon's at the bottom of that. And I'll see if I can find my picture of that here in a bit. But the colon's at the bottom of that. And if that's not working, your liver isn't going to be able to do its job. And then that opens backup channels to the skin, the liver, and the kidneys. So those all start to have issues with draining. Your lymph system, which drains your brain. Your brain has its own glymphatic system, which drains into the lymphatic system, which has approximately twice as much liquid volume as your blood does. It drains and coordinates with this regular circulatory blood system that you would think of. But your organs stop functioning. Your brain, if it's not draining you, you're starting to get brain fog and memory issues and fuzzy and fatigue, and like, what was that word? I know exactly what it is, and where did I put my keys? I know I just had those. That kind of thing starts to happen. And it goes all the way up to the cellular level, where we're looking at the mitochondria particularly. I mean, there's a lot of different little organelles inside the cells, but the mitochondria are kind of more of the big thing now.
Can you just stop and explain, because maybe some of the viewers don't even know mitochondria.
Right. So we're hearkening back to high school biology here. Hopefully we're not scaring anybody too much. But the mitochondria are the powerhouse, the energy processing plants of the cell. They do so much more than that, though. But they're little capsule shaped things with little squiggles inside is kind of what you would see back from school. And I have to find my image of it here. But basically, they're producing your energy, and it's really interesting because with that, your body is making 40 to 100% of your body weight daily in energy, and it makes ATP is the currency of that energy. And so that really gets, that's a lot. If you're 150 pounds, you're making anywhere 40 to 100% of that, and the math, 50 to 150 pounds, give or take, of that per day. And obviously, if you're chronically fatigued, it's going to be on the lower end of that. So here's a picture. This is kind of more referring to life in general and the energy. We're getting our energy from plants and animals, and making it. So here's the whole cell, and then here's the mitochondria, and it's got all of these inner folds, and these inner folds are where everything's happening at. Your carbon dioxide, your mitochondria make at least 1 liter of water per day in an inactive person, up to gallons, in somebody running a marathon. So it's kind of similar to plant chloroplasts. Again, that's some high school biology there. But your oxygen is being used in the mitochondria, and ATP, adenosine triphosphate, the long name for it, is what results from all of the chemical processes that go on in there. And that's like your gasoline. Your body needs that. It doesn't function well without it.
So what's the role of then the ATP in your immune system?
ATP, then it's making everything function in your immune system. So it's all your cells have different channels. So the ions that go in and the ions that go out, all of the movement of the cells around the body require energy. It powers your muscles, they power your heart. You've got something like 16 quadrillion mitochondria in your body, and different cell types take more and some take less. I'm not sure entirely, what the average is for an immune cell. The average cell runs about 2,000 mitochondria per cell, and they're functioning on the energy piece. But they also, once you run into something that triggers what we call the cell danger response, also the healing response, those mitochondria shift from energy production into immune function, and they do a lot of different things there. So they initiate cell death called apoptosis, which you may be familiar with. And if that doesn't work right, cancers are a result of that, or the mitochondria is telling it to heal and repair, so they're responsible for DNA repair as well. And you can't do 100% of both. So you have to, and once you enter that healing phase, you have to go all the way through it to get back to health. You can't jump off at any one phase. It has to go all the way through.
Sorry, I feel like I'm monopolizing all the questions, Emily. How do we optimize then? Is there ways then we can optimize our mitochondria for optimal function?
Right. So you want your mitochondria to be ready to go into battle mode as needed, but they need to have enough energy. And there are so many things that actually damage that. How many drugs are there in the PDR now? Like 25,000 or something? None of them heal mitochondria. And I don't have anything out there against prescription drugs. Lots of them are useful and necessary, but things like statins damage them. So they're blocking CoQ10, which is one of the necessary steps in the mitochondrial process of making ATP. And that's where you get a lot of the side effects from those. But antibiotics do too. Now, I use some antibiotics. They're very helpful at times, but they're damaging things as they go. Each of the different little phases in there require different materials and coenzymes and vitamins and things. But those get damaged by toxins. Heavy metals will block those. Parasites hang on to heavy metals. I don't know that parasites directly interfere with that, but they do suck your energy. So those can be kind of there. But viruses, they insert themselves into your DNA and start messing around with things. So that can be a really big problem. So removing the toxins and the environmental chemicals and all of that kind of stuff really makes a difference. Because, and especially, in fatigue, hormone picture, a lot of the diseases, between diabetes or menstrual problems with irregularity from infertility to menopausal issues, your mitochondria are where all of your steroid hormones are made.
Oh,
Wow.
So, what we've been referring to as adrenal fatigue for years and years has the medical doctors there's no such thing, that doesn't exist. And it turns out they really are right. The symptoms are there, but it's a mitochondrial dysfunction problem. It's not originating in the adrenal glands themselves. And so that's one of those things I'm going, aha.
Yeah.
That explains why sometimes for some people, those adrenal repair protocols aren't really fixing it as well as I thought. Some people, it's perfect, but not for everybody. So taking care of those involves, mitochondrial care, stopping as many of the toxic things that you can. Detox is definitely a piece in there that can be really helpful, but trying to take as many things as we can. And then some of the adaptogens are helpful. And my current favorite thing for mitochondrial repair is bioactive carbons. And those are phenomenal molecules that they have a lot of energy. So the current detoxing thing, you're familiar maybe with chelation and with activated charcoal and bentonite clays and some of those other zeolites and that type of thing, which can be helpful, but they don't make it out of the gut usually. And activated charcoal, as great as that is, and I've used that. I mean, you get the stomach flu, you want something like that to bind up the toxins and get it out of there. Yeah. But activated charcoal has no energy. There's no life in that molecule. It's basically ash from your fireplace, from wood that's been burned and treated with acid to create more holes in it to hold more stuff. So it's making a holier sponge. The problem is when that sponge gets full, what happens when you drag your over full kitchen sponge from the sink to somewhere else? It's going to drip all over the place, right? You don't want your body molecules carrying stuff out to be dripping and leaving stuff behind. So if you're doing a metal chelation protocol, the molecules for that, they only last 4 hours in your body. So if you're doing a serious heavy metal chelation protocol, you have to be up every 4 hours, even in the middle of the night, to take those supplements. Now, bioactive carbons, these are entirely different molecules. We're talking from living cellular structures. You've got your humic and fulvic acids, which have started being studied here fairly regularly, but they actually, when you look at them under the microscope, they vibrate, they have energy. So not only can they get into your cell and back out and all the way out of the body, they're binding onto stuff tight. They're not letting that go. I mean, it's just not going anywhere. But those molecules, they also carry carbon and hydrogen and oxygen, which is the backbones of what your body's made up of. So if you're short on those, they donate those for cellular repair. There's minerals, there's nutrients. They carry all of those things in, bind to the bad stuff, and have enough energy to get out of the cell and carry it all the way out of the body. Which really helps the mitochondria, because you're able to repair because you've got all the materials. So it's like having a handyman and a garbage truck and a food delivery service all in one. And I've been taking some since October of last year, and especially in pregnancy, it's a really common time for fatigue, but it makes a huge difference. And as I was recovering with a family a couple months ago from the stomach virus, I'm sitting on my couch going, my arms and legs feel like lead. I have no energy. I can't do anything. I just don't want to even move. I got up, went to the kitchen, got some of my Mito ATP, which is a really nice liquid drop, fabulous product. It's one of my favorites. Put some in water, drank it, sat down for about another 30 to 45 minutes. And then without even really thinking about it or planning it, I got off the couch, did the dishes in my disaster of a kitchen, and ran like 3 loads of laundry and folded it all and put it away without planning to. And I just went, wow, I wasn't even going to get off the couch today, and all of a sudden my house is clean. How did that happen? This stuff is amazing.
Wow.
But, on a daily basis, helping with energy and mental function and clarity, the stuff is really, really good stuff. So that's one of my favorites as far as that goes. And that's one of the first steps in treatment of things, is open up drainage and restore energy. Because then as we get the mitochondria powering up better, the toxin level will start to come down, because the mitochondria do a lot. They signal a lot. They're making that all decrease. And so it makes a huge difference there. So just that mitochondrial support starts to restore normal function to the body, even before you really start killing and removing further toxins and infectious material.
So you recommend starting with the drainage before we work on detoxing the rest of the body?
Absolutely, especially for people with autoimmune conditions, because if you're familiar at all with treatments for those, Herx reactions, Herxheimer for short, or for long, I should say, they're really common when you start to, killing off the bugs or using the drugs to decrease symptoms. You're getting a lot of reactions, because especially with some of the natural treatments, antibiotics, those bugs put off some really nasty chemical signaling molecules because they're under stress. So they're like, oh no, we're dying, send out the army. And it makes you feel terrible because it's setting off all of your systems to fight that. So if you're doing that too fast, and if you're not having a regular bowel movement, it's going to get stuck in your body. All of those nasty reactants are there, causing your symptoms to flare. So so it can be kind of hard sometimes to tell if it's just a flare of the disease or if it's a flare of treatment. But generally, you can kind of tell, like, wow, I started taking that, and for the last 3 days, I can't even function, doc. What did you do to me? Well, maybe we went a little too fast. So the missing piece there is opening up the drainage so that you're having bowel movements, your liver is flushing things out. And parasites, they block the liver, they can block the colon. It can be real hard to sometimes get that moving, but there's herbs to do that and really just make that work. And it's hard for your immune system to fight off if you don't have energy as well. So building that up, a lot of times, that first 30 days phase treatment that I start people off with, they'll notice a little bit, but it's not, necessarily huge gains. But for some people, I've got some patients on that. They're like, wow, I actually got off my couch. I really actually cared about the dust bunnies behind the bed. I can clean those now. I didn't get home from work and just, Netflix binge for 6 hours because I couldn't do anything else. So you're noticing that, actual living improvements in how the quality of your life is before we start killing and removing gut pathogens.
So I have a question about parasites.
Huh?
So that my understanding is they're quite common, more common than we know. If you think you have a parasite, though, like they're elusive, right? They're clever. So how do you definitively know if you have a parasite, and where do they hide, and like where are they typically found?
Right. Well, some of the docs I've learned from the simplest test for parasites is this: are you breathing?
Oh no.
You probably have parasites.
Okay.
And that's disturbing. I've done some stool testing for them. Sometimes I find them. Lots of times I don't. They're, like you said, they're slippery. They're tricky. They die, and when they die, they disintegrate. It's like, like the message that the self-burning messages from the spy movies or something. You have 10 seconds before the self-destructs, and then they're gone. Lots of them are microscopic. Some of them are larger, and those are the ones that are more disturbing when they come out. You tend to know that, and that's not so much fun. But the better out than in is kind of where you're gonna hashtag that stuff on. But most people probably have them because if you I live in a farming and ranching area, so there's lots of cows and of course your cats and dogs. If you've got pets, you're giving them deworming things, heartworm and all of those other things. They get those. Cows, same thing. You get those treatments every year. But people, you ask your doctor, no, you don't have parasites. That's not even possible. But it doesn't make sense. I mean, we're importing food from around the world. Parasites. When I was in, infectious diseases class, it's like, these are, third world countries. If you're traveling to Thailand, you want to watch out for these things. But the reality is we're importing a lot of food. We're importing a lot of people. People are traveling to different countries and coming back. So it's everywhere. And hand washing hasn't always been the best of cleanliness habits, The sad to say, the fecal oral route, meaning, diaper changes and bathroom use, and people aren't getting everything off their hands. So, and it comes in on produce and things. So they're exposed, and you can sneeze them out. I mean, they come out through the nose. There's parasites. I don't remember which one it is, but you swallow it. It starts its life cycle in the gut, and then you cough it back up. I mean, it goes from your lungs and nose. They're super gross. They can live just about anywhere in your body. It's really not fun to think about, but it's a reality. So they're there, but they're hard to find. They hide. They don't hang out in your bloodstream, and they don't always necessarily hang out in your gut. And when they do, they're good at hiding. I've heard of people finding worms in their stool, putting them on top of a stool sample, sending it to the lab, and still getting a negative test result. So clearly our tests haven't caught up with the sneaky nature of those bugs yet in all circumstances.
So how do they affect the immune system? They're hiding in our body. Does the immune system know?
Sometimes, but they can go inside of cells, and they actually put out things to modify your immune system so that your body can't respond to them. One of the ways that I look for it, say on blood work, is there are a couple of immune cells. You've got your basophils and your monocytes, and those are particularly suited for going after those eosinophils and basophils. Monocytes are your initial immune response. My bad. So your basophils and your eosinophils. If I see those high on somebody's blood work, eosinophils can be high due to allergens or parasites. So if it's the middle of spring and you're sneezing your head off, it's probably more likely seasonal allergies, which can go back to deeper levels of inflammation as well. Dietary pieces, inflammation can just kind of overflow that bucket. But that's kind of another topic altogether. But as far as that goes, you've got those factors working against you. So if you look at the eosinophils and they're out of the normal range or the optimal range, that's an indicator. Basophils as well. It's not specific, but it is, there's a clue there that there might be something going on. Do we test for it? Maybe. But again, I get back a few positive tests, but I'd rather take people through a program that will actually heal that rather than, spending a few $100s on a test. Now, granted, there are occasions where that's helpful, and there's some really good GI testing out there, but they can't test for every possible parasite. And like I said, they hide, they disintegrate, they may not come out. So it's one of those things where if you're doing it properly, the treatment is much safer and much less problematic than trying to find the buggers in the first place. Because it's like, well, the test doesn't show they're there, so that must not be the problem. But it's not necessarily a guarantee. The tests don't catch everything.
Wow.
So do they weaken the immune system? Because the immune system, the ones that you said it raises some of the immune cells, the immune system is busy taking care of those. Does it then depress the immune system for other viruses and the like?
It does. So there's, in the immune system, there's what we call a Th1 and a Th2 response. And I really hope I'm getting this straight, but your parasites are taking, I think it's the Th2 response that's dealing with the parasites. And when your body is putting all of this effort into fighting those, the Th1 that's going to fight viruses and bacteria. And again, forgive me if I've got that backwards. The immunologist out there will probably be shaking their head at me right now. But basically, you can't run both of those at the same time either. So if your body's busy and the parasites have you all blocked up on this side, you're not going to be fighting those viruses. So things like Epstein-Barr and cytomegalovirus, Lyme disease, all of those other things that this side of your immune system is supposed to be fighting, it can't do that. So by treating parasites, you're actually going to help with the response to the flu and the common cold and whatever happens to be going around. Your immune system will be compromised there.
So what are the top 3 things from your point of view that people can do right now and in general to support and balance their own immune system?
Right. So my favorite thing, food sensitivity testing. Well, I guess you kind of need, there are some home test kits for that, but just for improving general health, biggest one, make sure you're having regular bowel movements. There's even resources online. Bulletproof has some, lots of websites have some on how you can look at your own poop. I'm sorry, it's kind of gross, but look in the toilet, see what's there. Does it look like a healthy one? Does it not look like a healthy one? Find some pictures online of what it should be and make sure you're going, because if your funnel is blocked, nothing else is getting out, and you're self-toxifying, a condition that old-time naturopaths refer to as toxemia. So get your body flowing, make sure you're going, and make sure you're hydrated. You're getting enough water, because you'll be constipated without it. Many cellular processes rely on water, and while your body's making some, and the water your mitochondria makes, actually some of the purest water there is, it's doesn't have a lot of things in it that your water does. So purified water. So making sure you're pooping, there's herbs to do that. Dietary things can help with that. I've got, some really good herbal blends, like I said, that I'll use with that. And that's in phase 1 of the protocol that I put patients through. But pure water. And that's a big one. Finding a really good quality water filter that gets everything out. What I personally use one from Pure Water Systems has been my favorite so far. And that one uses a carbon pre-filter. It has a reverse osmosis, and it also has a deionizer, which most people probably aren't as familiar with. But if you're in a chemistry lab, that's what they use, deionized water, because water, all the minerals and salts and heavy metals and things, they'll interfere with chemical reactions in a lab. So they run it through this big fancy machine that pulls everything out. So you're left with nothing. And that's much more effective than even just, your countertop distillers or things like that. So that's what I've been using. And we have extraordinarily hard water where I live. I mean, it's terrible. The damage it does to my hair, we won't even go there. But I run the filtered water through my teapot, and I have never had to clean it or descale it or anything like that. Mm-hmm. And everything has a pure taste. So that's been my favorite. I've been running one of those for, 6-7 years now. That's my favorite. And there's a few different versions of that. So that would be it. And then, working on mitochondrial energy is going to be immensely helpful, no matter what you're dealing with, whether it's a simple, infection or pregnancy even. Like I said, all of these things are going to be helpful. Mito ATP is the name of the product that I use from Cellcore. And that stuff is amazing. It's a liquid. Even kids can take it. You don't have to use large amounts. Some people need 1 drop. Some people can take teaspoons of it. It does some pretty amazing stuff. Marathon runners can do better, improving times. I met a guy who was taking this, and I think he was taking probably teaspoon doses of that and some of the oxygen product. And I don't know what the name of those races are where you're going like up a big mountain and doing obstacle courses on the way. And he's, in his 50s and improved his time by 5 minutes, and he'd get done with that and not have the debilitating soreness afterwards. And I'm like, I have no desire to do that, but I definitely like the idea of the result.
I feel like I can do that though.
Right. Well, just having less muscle soreness after your average workout is helpful. Or
when you get up in the morning.
Right? I took my Mito ATP this morning. I put it in the water I take my vitamins with, and it makes a big difference in just how you're overall functioning. But even using that to help prevent muscle soreness from your average workout, it's really great that way. So those are the top 3 things. And then your body can start to function better. There's a lot more in-depth protocol that I'll take my patients through, which can last anywhere from 4 months to, a year, maybe even longer. It just depends. There's the 4 basic phases. And if there's an autoimmune disease and we're fighting mycoplasma or Lyme or Bartonella, all those different co-infections that go along with that and lead to some of these autoimmune diseases, there's herbs that you use with that as well. But we're treating, with the protocol, we're eliminating parasites, we're eliminating glyphosate, heavy metals, your radioactive materials, all in order. And there's very few contraindications to it. I mean, some of you're not going to do that. I'm not doing it pregnant. And some of those, you can do while you're breastfeeding, but there's some of those with, you wouldn't use with nursing. Like, you're probably not going to want to, start moving heavy metals around while you're nursing. It's not generally advisable at this point. But, I've had kids doing at least portions of the protocol to get rid of pinworms and things, and it's worked really well. You can open most of the things. Some of them are liquids, and the results I'm getting are pretty impressive.
Wow. Can you also, what herbs specifically are your favorites or most effective in your mind?
For what?
For overall, just improving immunity. When you talk about using herbs, what type of herbs?
Sure. I use a lot of different ones, and there's of course blends that have some. As far as single herbs go, cordyceps is a mushroom, and I love that. Mushrooms do so much for your immune system. Mm-hmm. And cordyceps, it's an adaptogen. It also helps with hormones, and I believe it has a long history in, I want to say Japan, where royalty used to take that to help with anti-aging. And that one is also a big fighter of mycoplasma. So that's one I use there. It helps with a number of different conditions, but it's very energy boosting as well. So that helps with a number of different things. And rhodiola is another one I really like. And that's another adaptogenic herbs. There's lots and lots of them. Rhodiola is one of my favorite because it's safe for pregnancy and nursing. And clearly that's been a major part of my life thus far. So I started taking that the first time when I was pregnant with my first child. And I went to a conference in Colorado at 9,000 feet. And I think I just barely into second trimester. And I felt better than some of my colleagues who weren't pregnant. They were, much more out of air and things than I was. So rhodiola is another really good one. And it's in a lot of blends. Mm. But I'll use that one on its own sometimes as well. But yeah, as far as picking a favorite, that's like trying to pick a favorite child. It just depends on the
Yeah, don't do that.
Yeah.
There's good ones for lots of different things. It just really depends. There's so many things. And some of my favorite books, one of my favorite herbalists who writes some really great books on antivirals and antimicrobials is Stephen Herod Buhner. And his books are available on Amazon, really easy to find. And as opposed to, a lot of science books that are real heavy and dense to read, he's got a good sense of humor. So there'll be a joke in the middle of something and, a reference to Star Wars or something. So you just keeps it from getting too heavy. But there's a lot of good herbal monographs in his books and instructions on how to do that. And you can make a lot of your own. It takes some time and lots of alcohol to make your own tinctures, but it's definitely doable for some people. A lot of the herbs that we need grow around us as weeds.
So before we go, can you tell everybody where can they find you?
Mm-hmm. Yeah, so I have a website. It's radiantnaturalhealth.info is my main website. I'm also on Facebook, and we try and post some good information there as often as possible. And on Facebook, it's Radiant Health Medicine is the link there. And you can reach me by email as well at Dr. Keller at radiantnaturalhealth.info at the website there. And we are looking forward to helping lots of people. I do some consults with folks and we can set up longer term programs. Just kind of depends on what works and what people need. But again, I'll be, functioning online and able to help a lot more people that way once I get back from maternity leave.
Right. And when will that be?
I'm planning on being on maternity leave for the entire month of May and coming back at some point in June. It'll kind of depend exactly on when the baby comes, which is always
maybe not up to you.
Yeah, not so much. We try, but yeah, since I'm not doing the planned C-section route, nobody knows for sure. But yeah, I should be pretty much back to functioning on some kind of a normal schedule by June. And for now, until the end of April, I'll be still seeing patients as much as possible.
Terrific.
Thank you so much for sharing your wisdom. It was really informative. And I know our viewers are going to get a lot of good information from that. And I don't think I've ever considered my immune system from the standpoint of mitochondria and parasites. That was a little disturbing.
Yeah. Just be glad I didn't have to show you any pictures. The last time I saw it, I'm really glad lunch is another 2 hours away because nobody wants to see pictures of that. Not really.
Well, thank you again for coming on and sharing your wisdom.
Thank you. It's been great. I've enjoyed our conversation.
Phenomenal conversation. Thanks very much.
Thank you.